Nanny need to have a care plan for infants in order to make sure that you do not miss a necessary task like vaccines administration. Also, having a care plan makes the whole process easier by giving you an overview of 1 month or even a year. Generally, the following topics are included in the care plan of an infant. Taking steps for promoting infant health even before the birth. Screening of newborn child. Basics of infant health like feeding and well child health care. Immunization. Infant oral health care. Sudden infant death syndrome SIDS. Taking care of hygiene. Knowing why the baby is crying. Sleeping. Car safety. These are just a few topics that should be included in the care plan of an infant. By any means, this is not a full list of things that need to be taken care of. Since every child has different needs, there is no one care plan that can be applied for every infant care. To make a care plan, nanny must be qualified also in care plan and how to execute it effectively. A nanny for infant care usually has years of experience in taking care of infants. With the developed expertise, he or she will be better able to take care of child. A swaddle helps your baby feel safe and secure as she adjusts to life in the outside world. They're used to feeling snug in the womb, so they find swaddling comforting. Swaddling helps prevent your baby from flailing those little arms and legs, which can trigger her startle reflex and potentially cause her to wake up. This may prevent them from settling down and getting deep sleep. The swaddle helps dampen the startle reflex until a baby outgrows it. A swaddle keeps baby cozy and warm until her internal thermostat kicks into gear. In short, there are lots of good reasons to try this age-old practice. But figuring out how to do it yourself can be a little intimidating, especially when you're feeling bleary-eyed. Here's a step-by-step guide on how to safely swaddle a newborn baby like A. Pro and when it's time to stop swaddling. Getting your swaddling skills down pat may seem a little daunting, but wrapping up your baby only takes a few steps. Spread your baby's swaddle blanket out on a flat surface like the middle of your bed in the shape of a diamond, with one corner pointing up. Fold the top corner down about 6 inches. Here's when babies can start sleeping with the blanket down. Then take the left side of the blanket and wrap it over her left arm and chest. Tuck the blanket underneath her right arm and her back. At this stage, your baby's left arm should be covered and her right arm is free. Bring the bottom corner of the blanket up over your baby's body and tuck it under the first fold, below her chin. Gently straighten your baby's right arm down like you did with the left. Be careful to wrap baby snugly, but not too tightly. Pull the right side of the blanket over baby's body and tuck it snugly under her left side. Twist the remaining piece of blanket at the bottom and tuck it under your baby. Again, make sure the swaddle isn't too loose or too tight. Keep these important tips in mind when you're swaddling baby. You should be able to place 2 to 3 fingers between your baby's chest and the blanket should be loose around her hips so she can move her legs freely. If your baby seems to prefer having her arms free, it's fine to leave one or both arms out of the swaddle. If baby is too wiggly for you to get a snug swaddle, take a break and give your little one a few minutes to get her squirmiest out before trying again. But if it seems like your baby is always trying to wriggle out of her swaddle, she simply might not be a fan. Not all babies are or might be getting too active for swaddling. Try a different type of swaddle. You can try a Velcro swaddle wrap or one with zipper closures. Recommends or stop swaddling altogether, since a kicked-off blanket while your baby is sleeping can pose a suffocation or strangulation risk. At her sides, which can be more comforting for some preemies. Swaddling is just as soothing for premature babies as it is for full-term newborns. But consider bringing your preemie's hands together on her chest in front of her instead of straightened. Like the idea of swaddling but don't want to use a blanket? Swaddle wraps with Velcro tabs or zippers are as safe as blankets and deliver the same benefits without the need for any folding or tucking. The specific instructions vary depending on which wrap you buy. It's often easier to get a tight swaddle with a wrap, which can be more comforting for newborns. They're also much less likely to become undocked than a blanket.